Welcome to KUBBY TV and an opportunity to see interview 3 with my special guest this week, Dr. David Allen, a former heart surgeon and world authority on cannabis medicine. Now today we're going to really get into the good stuff. I'm going to ask the good doctor some really controversial questions, and I think we'll get some really interesting answers from him. So my first question for you, Dr. Allen, is about the assertion that I'm hearing more and more from scientists and physicians that most of the diseases that we see today are the result of cannabis deficiency. That's right. I know prominent scientists and distinguished doctors that are convinced that it is the removal of cannabis as an edible and as oral medicine, as a smoked medicine. It's the removal of cannabis from our life that has created an epidemic of disease, of cancer, even the disease of obesity. All seem to relate to this master control mechanism, the endocannabinoid system, and its ability to create balance, homeostasis in the variety of physiological functions that make up our human body. Now, Dr. Allen, is this really true? Can it really be true that so many of these diseases that we face today are the result of not getting enough cannabinoids in our diet?
The endocannabinoid system controls virtually all physiology. And we're finding out that it controls glucose metabolism. If you use cannabis for 20 years or more, the chances of you getting adult onset diabetes mellitus is 66% less. And no other chemical on the earth does this. So it controls glucose metabolism. We're learning it also controls fatty metabolism. And they've proven that people with cancers have lower numbers of functioning cannabinoid receptors. There seems to be some kind of link with the endocannabinoids and cancer. And so we're in the infancy of this study. We're finding out that endocannabinoids affect seizure activity and all kinds of spastic activity. So there's diseases like Dravet syndrome, which is a disease where children are having 400 and 500 seizures a week and are completely unresponsive to all pharmaceutical medicines, even experimental pharmaceuticals. And they can give these patients a little cannabinoid or cannabidiol tincture, and it stops their seizures, and the children begin communicating when they've never done this before. So the endocannabinoid system is so complex that the humans are really not educated enough to study it right now. And there's political repression of this study. The United States government has a patent on cannabinoids as antioxidants and neuroprotectants. It's patent number 6,630,507, cannabinoids as antioxidants and neuroprotectants. And in this patent that came out in 2003, it shows that cannabidiol decreases the size of a stroke by 50%. And no other chemical does this. And so this is like a miracle that cannabidiol would decrease the size of a stroke. And they talk about a bunch of the different mechanisms that this occurs by. There's other patents that show the same thing happens in heart attacks that the heart scar after a myocardial infarction is 66% less after cannabidiol administration. So the sum of what all of this knowledge seems to be is this. This medicine called cannabis is more than a pharmaceutical. It's not a pharmaceutical. It's a nutraceutical. It's not just a pharmaceutical. It's something that your body needs on a daily basis, and it will protect you from all kinds of diseases. It'll protect you from diabetes. It'll protect your heart. It'll protect your brain. And if you eat cannabis raw, you get the acid forms of the cannabinoids, and these seem to have great antioxidant effects. And in the near future, people will be eating raw cannabis in their food, in breakfast cereals, in smoothies. You could put it on a peanut butter sandwich, peanut butter and jelly. The cannabis tastes fairly bad, and if you have to hide the flavor of it, but if you can consume this raw, it will protect your grandmother from a stroke. And so this is a nutraceutical that people should eat on a daily basis.
Well, that's fascinating. But tell me this, Dr. Allen. You and I have had some discussion, and you have some pretty radical views that I happen to agree with about the future of heart surgery and treating people with heart disease. I'd appreciate it if you'd take a minute and tell us about that.
As a cardiac surgeon, my job was to protect the heart from oxidative stress. And what happens is there's a phenomena called reperfusion injury. And whenever you stop blood flow to an organ and then reestablish oxygen flow to that organ, what happens is the oxygen disassociates and becomes oxygen-free radicals and actually worsens any kind of a heart attack that you have. So one of my jobs is to protect the heart from oxidative damage. And it occurs not when you're working on the heart, basically. It occurs when you open the cross clamp and allow the fresh blood to come back into the heart. That's when the damage occurs. And so in the near future, cardiac surgeons will be given synthetic cannabinoids, or maybe plant cannabinoids that have been purified. They will be giving these cannabinoids to patients before they go on bypass to protect their heart from reperfusion injury. Now, another point is we found out that brain tumors are inhibited by cannabis because they found out that cannabis, or cannabidiol, and THC both inhibit this substance called vascular endothelial growth factor, VEGF. And VEGF is produced by the body whenever there's low oxygen states. And VEGF also heals the inside of arteries whenever there's damage. So it heals the endothelium of the artery. And it causes blood vessels to grow into areas of low oxygen perfusion. And so certain tumors of the brain, gliomas, secrete this vascular endothelial growth factor, and when they secrete this, it causes blood vessels to grow into the tumor, and the tumor enlarges by that mechanism. Well, they found out that since THC and cannabidiol inhibit VEGF, that it decreases the size of the tumor, and some gliomas are actually killed by starving them from blood supply by this mechanism. And so also wrote a paper about how coronary stents may possibly be kept open by cannabinoids. And if cannabinoids inhibit vascular endothelial growth factor, whenever a cardiologist puts a stent in a coronary artery, what they do is this metal stent opens the artery, and it makes small cuts in the wall of the artery, and the balloon allows the artery to expand after these cuts are made. And the vascular endothelium heals the artery by sending the scar over these little cuts. And in a large percentage of cases, this healing process is over-exuberant, and the scarring continues and continues until the lumen of the artery is completely closed by scar. So it's called in-stent restenosis. And they have a lot of different chemicals that they give patients to prevent this now. Plavix is one of the major chemicals that they give patients to keep this artery from this healing process from closing off the artery. And Plavix is a very dangerous medicine. So it's my theory that if cannabidiol inhibits vascular endothelial growth factor, that it probably would also inhibit it when the artery starts to heal itself, that actually by inhibiting VEGF, cannabis and your endocannabinoid system may keep your coronary stent open longer.
Well, as you can see, Dr. David Allen is a pretty amazing guy. And the science and medicine of the endocannabinoid system is certainly one of the great discoveries of the last 100 years. And it's a discovery that's being fought every step of the way. Well, we know that this is real. And we can use this medicine right now to make ourselves healthy and strong. I mean, I'm 66 years old, and I don't feel or look 66 years old. And I can tell you, I've smoked about 10 1-gram joints for most of my adult life, 12 grams a day. So I think I represent, at the sort of the more extreme end, what cannabis can do to the human body. And what it does is it offers the fountain of youth. It offers health, clarity, vitality. You know, I just saw a study that says that cannabinoids cleanse the brain and actually heal damage that has occurred in the brain. And so people who smoke pot on a regular basis may have a little trouble with remembering something while they're really high. But through their older years, they will continue to remain clear and lucid, while their friends who are on alcohol and pharmaceuticals become more and more obviously mentally impaired. By the way, I've always likened the problem that we have with Congress in that the problem with the marijuana laws is that they're all being made by alcoholics, the alcoholics that binge drink and characterize the typical congressman or senator. So we have the answer. We have a medicine that works. We have something that provides health and youth for many, many years versus something that's being forced upon us by a government that doesn't understand or want to understand the emerging science and medicine of the endocannabinoid system. Well, that about wraps it up. Join me here tomorrow, and I'll see you then.
Proximity of what I hope to be. so heavy where I stand.